Hello and welcome to another Unfiltered production. You've got myself, Sherry Teague, and Cindy Kraft. We're both owners of K&K Healthcare Solutions, and we're here today to talk to you about quarterly OASIS Knowledge Assessments. In 2022, one of the things that we've noticed, and especially the last 6 months, is that there's a lot of stress and anxiety about hiring and having enough folks on board to take care of our patients. And one of the reasons why we developed this quarterly OASIS assessment is to help your agency become very efficient in their review process. You know, when you get in that cycle of the checker checking the checker checking the checker, you spend a lot of money doing that. And I wanted Cindy, why do you think this is so important right now?
Well, when it comes to determining a course of action for OASIS education, I think we very often kind of default to a blitz approach that we're hearing anecdotally from our reviewers about, we're seeing errors in this or errors in that. And we don't really, in many organizations, there isn't a actual mechanism for tracking and trending errors. Some of the EMRs do it by individual, but I'm not seeing too many that really utilize that to say, if these are our most commonly seen errors, then this needs to be our focus in the next quarter with respect to education. Because there's nothing worse, and I'm sure our listeners have had this happen, when you're brought into an educational event and you're sitting there going, I already know this, or I know at least half of this, or I already do this. Why am I losing time that I could have been spent doing other things now being taught, air quotes, something I already know? So this idea of a quarterly OASIS assessment was not to say this is how we're going to give people credentials or a certificate type thing, but it's really meant to be a boots on the ground tool for agencies to say, where are my gaps at this point in my clinicians' knowledge of OASIS? And it's not, I can use it for my clinicians and I can use it for my reviewers, because what we find is, although they may have gone to a formal training at some point, for many of them, it's kind of been a while and several Q&As have happened since then. Do I know that everybody who looks at this thing is on the same page with the most current information? So we developed this knowledge assessment to really give agencies in real time a feel for what are their clinicians struggling with. And what's been interesting as we look at this quarter so far, what we're finding is that the knowledge gaps are kind of all over the place. We're not seeing anything materialize that say, for one particular agency, they're always missing the wound questions. And that makes you wonder, well, okay, clearly there's a shared confusion in the organization about items surrounding wounds. What I am seeing is it's all over the place. It's dispersed. Some clinicians are struggling with the functionals. Others are struggling with issues around the physician ordered start of care date versus a referral date. And so what this is meant to be is not a punitive thing, like we're going to make you take tests, but really to give agencies feedback to say, here's the results for the individual clinician. Here's the results for the group as a whole, so that you can make decisions going forward. And Sherry, although we labeled it a quarterly OASIS, we have the option for agencies to do this annually if that's what they want to do, or semi-annually. So nobody's committing to it has to be 4 times a year. But what we found is there's a gap out there in how do we objectively try to quantify where these gaps are. And that helps us make efficient training. So if it really is an individual issue, then let's bring that individual or the 2 or 3 that are having similar issues together, and let's train them and let everybody else go do what they need to do with the patients. Or is it really something more pervasive? So it's only 2 or 3 areas that are affecting a whole bunch of people. So if we bring the group together, then let's just focus on those 2 or 3 and not spend time on all this other stuff when people can do those 2 or 3 and be on their way. So back to your staffing issue, if I'm worried about having enough people to get the patient care done that I don't have time to do this kind of training, well, we know that we got to do some training, and it's going to become even more relevant as we get closer to OASIS E. How do we train smarter? Not just go back to let's read every question or make assumptions that, oh, they already understand this, when maybe they don't.
And Cindy, I wanted to kind of piggyback on what you're saying. We did a survey recently in our newsletter that we asked the question, "Who were you planning to educate for OASIS E?" And it was very interesting, the information that we got back. The vast majority said that they will be educating managers and above, managers and higher, and expecting, I'm sure, those managers and higher to then educate the rest of the staff. And one of the things that we run into on the regular when we take over OASIS outsourcing, or if we do audits for OASIS for agencies across the country, we literally have this issue happen where we see inconsistent guidance being given to the frontline clinicians. And we know, as being former frontline clinicians, we know how frustrating that is. If you get, a phone call from reviewer A, you get this information. If you get a phone call from reviewer B, you get this information. And many times you just, the clinician, as you've said in the past many times, and our listeners would have heard this, they throw their hands up and go, whatever, just tell me what to put. That's not where you want to get to. So this test, is it for the frontline only, or can it help your review staff get on the same page?
I believe I designed it for both sides of this because you're absolutely right. I think sometimes, and I'm not criticizing reviewers, we do OASIS review, but we audit our folks on the regular to make sure that they're following the most current information. Because I run into folks that have been doing reviews for a while, and they're good people and they're really working hard. They missed a Q&A 6 months ago, and so the information that they're giving in the agency is not the most current, and we've been stuck in a limbo with the kicking OASIS E down the road so long that the OASIS D guidance manual in several areas is well behind the Q&As. And how involved have we been in the middle of a pandemic with everything going on and staffing shortages and all this other stuff? The idea of what Q&A came out now probably fell to the bottom of the list.
Yeah.
So this allows people to say, okay, how well did you do? And this is not a, you're wonderful or you're a bad reviewer or you're wonderful or bad clinician, but we're trying to help you understand where those gaps are and how we close those gaps. And I think this is going to become even more important as we move through 2022 to get a handle on as soon as possible those items that are going to be identical from D to E. Because if
Mm-hmm.
I'm struggling, and I think the classic example will always be the functional assessment. If I'm struggling to get my clinician to get it right the first time, if I'm spending resources having the reviewer send it back once, twice, however many times it takes to ultimately end up with a clean OASIS, those same questions are going to be on E. I got to put that stuff to bed now so that as we get closer to implementation January 1, 2023, then we can focus on that brand new stuff. And I don't have to try to juggle brand new information that they're going to really have questions about and should. This is new stuff combined with, but the patient told me he goes up and down the stairs when I'm not here. And so that's why I put this answer. This test can help us identify folks that are still struggling with some of those concepts and help us get them taken care of before we move forward into E.
I think that's so crucial. And I wanted to mention before we finish is that there's many features to this program. And one of the biggest features is the ease of access. This is an online test. It is graded right as the person takes it, and we can provide those reports to the leadership in your agency. There again, Cindy mentioned that the questions are driven by the most current official guidance. There's rationale that can be provided. And then we can create an education plan, or you can create an education plan around the deficits that are identified on this test. We have per user rates on this, and deep discounts if you use more than 10 users on this and sign up for the year's worth of testing. So again, Cindy mentioned it can be done quarterly, it can be done semi-annually, it can be a spot check if you wanted to do that with your clinicians, because it will be being updated with the latest Q&As that are out there. Cindy, did you have any more comments or information you wanted to share with our listeners?
I just think that we need as many different tools in the toolbox as we look at OASIS knowledge in 2022 preparing for E. That maybe, if we look back at how we prepared in the past or how we've educated to this point, if the way we've always done it has still led to a significant amount of errors and corrections, and the amount of money being spent on review and correction is still what we're not really happy with, then maybe we need to try something different. Maybe we need to take a different approach to this. And Cornetti and Kraft is committed to how many different ways the industry needs to get access to these kinds of resources, we're open to any idea. So we welcome you to reach out about this test specifically if you have questions. If there's other ideas in your head that say, I really wish there was a way we could do OASIS this way or that way, bring it on, because we want to make sure agencies stop this panic attack every time something happens with OASIS and make it so anxiety producing and so complicated that we want to make it simple. And we're not, downplaying it. It is a challenge, but if you look at the course of this year, by the end of this year, we're going to be moving from the practice year to the real year of value-based purchasing. And who knows what else is going to happen over the course of the year. We want to make sure that this is something that is not going to be the primary cause of GERD over the course of 2022.
And also, I wanted to mention, and I don't know if I made it clear, this is for purchase by agencies, but it's also for purchase by individuals. It's priced in a way that is very tenable. If you're an independent contractor working for multiple agencies, this is a way that you can test your own knowledge and then decide what education you want to purchase this year based on the deficits that are identified. And also, simply we're giving a discount if you take this test and then you want to buy our individual educational products. We're going to offer a discount to those that have taken the test, because our mantra this year at K&K is ease of use, making things easier and efficient and appropriate. Those things are so important to us as agencies try and navigate the challenges that we have currently due to the pandemic, staffing, education, new things that are coming out. There's just a million things that go on in an agency day to day. And then on top of that, some of the environmental emergencies that have happened. So just understand that K&K, we're your partner in home health, and we're going to help you get to where you want to be as an agency. Thank you, Cindy, for another great episode of our podcast, and we will be back. And if you have the opportunity, please listen to this and other podcasts that we have offered on our YouTube channel. And again, thank you for listening.